In a year when the NHS has been under immense pressure,
I want you to let me know if you get any pain.
Hello, correct. How much do you sell these for?
in the heart of Yorkshire,
You see, he's got a little mouth. Are you alright here?
a dedicated team is working around the clock.
Nice deep breaths. Did really well.
You can have a look in your ears, see if we've got any treasure in there.
So when you're ready?
I think we're ready.
They're with us for our most vulnerable moments.
Very, very painful now.
She's really struggling. I need you to stay still, darling.
It's like I'm in labour.
Facing life and death, trauma and tears, supporting each other through the toughest shifts.
Are you alright, though? You've done really well. Keep going, lads. Keep talking or singing out the stress. I've heard my singing. It's enough stress for anybody. How would you feel if I said you could go home? Happy legion.
This is Casualty 24/7.
Absolutely wonderful at Barnes Hospital.
On shift tonight, consultant Dr. Sue Mason,
Shall we just have a little look at the beast? There we are. Well, that's very impressive, isn't it?
consultant Dr. James Griffiths,
Sometimes when people have had a heart attack, they don't present with pain. So if the troponin is elevated, then we will suspect that she has had a heart attack.
lead nurse Hannah,
We have got quite a busy hot resource at the minute, so I've got 2 nurses working in there with 2 poorly patients.
and student nurse Greg.
I'm gonna try and get all this blood out your eyebrow. I'm sorry, mate, I'm sorry. We have to clean it, yeah?
So get ready to share a shift
Hey, Fallon, how are we doing?
with the team at Barnsley Casualty.
It's okay, baby, you've been really good.
As winter approaches, a spike in respiratory cases in South Yorkshire is having an impact on the department.
We've not had a CT yet. I'm trying to run before I can walk, just to clear the department.
Lead nurse Hannah is coordinating the shift.
They're now starting to come in quite quickly. Yeah.
Today, they've admitted a high number of extremely unwell patients.
Straight into...
During the pandemic, admitting patients with chest conditions has had to change. People at high risk of COVID and needing life-saving interventions are treated in a special area with a dedicated team, hot resource.
The big drain currently on nursing resources is in hot resource. It's very difficult to manage that at the moment.
Missions keep coming.
Hello, Barnsley Casualty.
Taking the call is consultant Dr. James Griffiths.
Whenever that red phone goes, you get that sort of butterfly kind of feeling. You've no idea what's going to be coming through. I always like to sort of hover near the phone and peer over somebody's shoulder and see what they're writing down and see how worried I need to be.
Paramedics are rushing in 62-year-old Carol, who collapsed outside her home.
We're going to sort it out, honestly, darling, I promise you, we're going to sort it out.
She was found confused and extremely cold.
You need to have a look at your heart. This afternoon she had a collapsed pericord in her garden. She's gone down approximately 3 concrete steps in an unknown direction. Unknown loss of consciousness. We've done an ECG. Yeah.
Paramedics are concerned Carol could have heart problems.
Hello there. My name's James. I'm one of the doctors. Okay. Just going to hear a little bit about you. All right. Yeah. Follow the sound of my voice. So she's fallen down some stairs.
Yeah, collapsed pericord unknown. She's been GCS 15 throughout with us. It was just when we've done ECGs, incidental finding that she's got this elevation under pressure.
Okay. Any pain in your neck at all, my lad?
No.
No. Just give my fingers a squeeze and pull me towards you. Push me away. Okay, lovely. Should we get this scoop out and then we can maybe get her sat up, can't we? And then she can... If we start sawing you in half, then that's when you need to get worried. You work hard in that first interaction to put elderly patients at ease. You know, they're a bit anxious, they're in pain, they're a bit frightened.
They're satisfied Carol doesn't have any head injuries, so they can make her more comfortable. Nurse Amy is closely monitoring Carol's obs.
I'm going to shine a torch in your eyes, is that okay? Look straight ahead at me, look in me in my eyes, alright, are you ready? And do you know where you are, Carol? Do you know what day it is?
Tuesday.
You're doing better than me.
paramedics said that you don't remember
I
anything
fell out
at all.
of the dustbin.
Okay.
After that, I don't remember anything other than finding myself laying down.
Have you ever had anything like this before?
No.
Right, well, we'll get some tests done, and then I'll come back and have a chat to you in a bit.
Right, thank you.
Is that okay, Carol?
Thank you.
Sometimes when people have had a heart attack, they don't present with pain, they can present with collapse or shortness of breath or other symptoms. The way to know for sure is, have they got any changes on their ECG, and have they got an elevation in what they call troponin. So if the troponin is elevated, then we will suspect that she has had a heart attack.
And another suspected heart attack patient has been rushed in by ambulance from a training session. 82-year-old Mick.
Mick today has walked out of a dizzy turn and fallen into a wall. Both his knees are very sore. He was a little bit confused when we got there.
I just collapsed. My knees hit this wall and got me out for a few seconds.
It did, didn't it? You're on for a world record, did you say?
Well, it was just a few seconds.
Aww.
Off the world record.
Amazing.
So we've done an ECG for Mick,
Yeah.
and we've found a couple of anomalies that will need investigating.
Thank you. I'm Harriet. I'm nurse looking after you. Let me do an ECG then while we're talking. I'm just going to lay you back a bit. I'll just lift your t-shirt if you don't mind. Right, keep still for me.
Sister Harriet doesn't want to miss any underlying issues. She's closely monitoring Mick's cardiac function.
Mate, just keep nice and still for me.
As his ECG was abnormal, Sister Harriet is testing his blood for markers that will indicate if he's had a heart attack.
Aww. I'm going to take some blood as well if that's alright.
Now,
Okay.
they must wait for his results. In resus, Carol is at risk of hypothermic shock, putting more strain on her heart. For both Mick and Carol, the next hour is crucial. Barnsley Casualty is experiencing a higher than normal number of critically ill admissions as winter draws near.
Getting patients that are potentially high risk coming through.
It's up to lead nurse Hannah to make sure COVID patients get the treatment they need, but everyone else is kept safe from the risk of infection.
So what we're trying to stop happening is paramedics bringing them into a cubicle at the far side of the department, because as soon as a paramedic walks all the way through, then we've increased risk to everybody else. So we're trying to keep this side of the department, because we've got double doors, for them hot patients to come into.
And she's managing a shortage of space,
See the guy that's in cubicle 1?
with more cardiac emergencies than usual.
So can we get him out of there then in a minute?
In Resus Bay 1 is Carol.
How long are you?
52. I know, 62.
62.
I wish I was 62.
She was lying injured on the ground for some time before she was able to raise the alarm. Now, she's waiting to hear if her collapse was caused by a heart attack. Overseeing her care is Dr. Griffiths.
So, her heart tracing is abnormal. We'll see what her blood test for a heart attack is. When someone's had a collapsing episode and they've got an abnormal heart tracing, then that needs further investigation.
That is a dangerous drop in body temperature below 35 degrees. Carol's is 34. Her dangerously low temperature could impact on her blood pressure. This, combined with concerns about her heart, puts her in a potentially critical condition.
Just checking the throat. See how you go. I'll come back and check your temperature about 10-15 minutes. Is that alright, Carol?
Lovely, thanks very much.
Right then, Carol, I'm just going to have a bit more detailed look at you.
But I'll warn you now, I'm extremely ticklish.
It really bugs my kids that I'm not very ticklish, so I can tickle them. But when they try and get me back, it doesn't really work. You can have a listen to your chest. Just need to give that a bit of a clean and see what is underneath. Are your teeth all still there?
I think so.
Yeah. So we'll give that a bit of a clean and see if it just wants some glue or some paper stitches.
Right.
There are some changes on your heart tracing. I think that might be why you've had this collapsing episode. But when the rest of your blood results come back, I'll come back and have a chat to you.
That's
All right. Okay.
While Carol waits for her results, in the hub, lead nurse Hannah is checking in with her team, who are managing the increasing numbers of patients.
Tell me about your patients.
As a senior leader within ED, it's very important not to show stress as much as possible. So when we are short-staffed, the whole team comes together to make sure their patients are safe and cared for.
What's going on? Okay. Fab. Brill, thank you.
Also keeping patients and staff safe and cared for is Matron Val. She's on a mission.
So, we'll start over here. Just relax, sharp scratch. We are immunising our staff against flu to protect them for the winter and to protect our patients. It won't. Very tender, just relax. Not bad, excellent.
If I scream and cry then.
You won't, it's my brilliant technique.
And Matron Val's got a reward for their good behaviour.
Help yourself to a sticker and a chocolate, my love. Chocolates are there.
Knowing the importance of vaccinations, Matron Val's determined not to miss anyone out.
Hello. Flu jabs, CDU? You have had jab, yeah.
And reinforcements have arrived. Joining Barnsley's paediatric casualty are Greg and Molly.
So I sort of got into nursing because they're always smiling, or there's always some sort of hope with them.
Like hundreds of student nurses across the UK, they've been fast-tracked into their placements early to boost the NHS's workforce. They'll help to relieve pressure across the whole department.
She needs a full set of obs first, then come and let me know where they are.
Yep, will do.
Greg and Molly are expected to both see and treat patients.
What is it, 60?
68, so you'd expect that to be higher.
Oh yeah, it's lower.
Yeah, but she's quite an active child, so...
I think for me, children's nursing, I knew that every day was going to be different, and that's what I quite like, going into work, not really knowing what you're going to get, but you know that you've got the skills that you should be able to deal with it.
Oh, has Dolly hurt their head too? Yeah, I'm Molly, I'm one of the student nurses. Do you want to come with me?
Must have been about 2, there's a photo somewhere, and I'm dressed up as a nurse, and my little sister, bless her, used to get covered in bandages and plasters, and you're the patient, lie there. This is what I'm doing now.
5-year-old Skylar has a head injury, so she's seen immediately.
What did you do to your head? You want Mummy to tell me?
Brother picked her up and dropped her and she's banged her head on a bed for it.
Oh no.
After initial assessment by Molly, Skylar's given the once-over by junior doctor Tom Fish.
My name's Tom, nice to meet you.
Yeah.
Who have you got with you today?
Baby Lucy.
Oh, baby Lucy. You got a poorly? Oh dear, it looks sore. Is it sore? No. Oh, that's good. You've been very brave then, aren't you? So I'll be hopeful that we might be able to put like, a little steri strip over it.
Yeah.
Just close it together. You may well get a tiny little bit of a scar. But it's kind of hidden in the eyebrows, isn't it? So it should be okay. Alright, sweet. It'll probably come together with a steri strip. We could try that first.
Yeah.
Are you guys
do it.
No worries.
Hello. Shall we put a stick on your little cup? Yeah?
Right. Can you lie down on here for me, please? Thank you. You're going to put your head here? Ah, you're so clever climbing up on there.
Not even ticklish. Molly is.
I'm very ticklish. You can't come near me. I'll just burst out laughing. Just give your Paulie a little clean. Oh, well done. Oh, you're doing ever so well. You're giving it a good squeeze. So I'm going to squeeze it to see how well it comes together. It's not going to come easy. Ready, sweetheart?
Good girl. Okay, baby, you've been really good. What are you going to do when you go home? Do you know?
A Chinese.
Good show.
There we go.
Little bit of glue. And then we've got to do Lucy, haven't we? Yeah?
Their friend and get to know them. And then all of a sudden you've got that connection with them.
Right,
Should we do
sit up
Lucy?
then and we'll do Lucy. I'm going to hold her hair back.
There we go.
I'm going to put one here like yours. There we go.
Then you'll have to give Lucy a big cuddle, won't you? Yeah? Right, then Mummy give you a cuddle, you give Lucy a cuddle. Oh,
There you go, you're twins now.
You get to go home now. And maybe have that chat Chinese. That's it done. Bye-bye.
I think the most rewarding thing about working in A&E is when you get to see that patient go home and they're smiling.
Sister Harriet is in the nurse's station.
Vicky, I've triaged the most gorgeous 82-year-old.
Oh, bless you, what's she coming with?
It's world record setting marathon walker. And this morning he's walked 16.5 miles, gone a bit dizzy, and then he's fallen and he's hurt his little knees.
Just a shame,
I know, like, oh gosh. I think my maximum was 9 miles. That was my record on the shift.
I do steps.
The majority of nurses, if not all of them, like to see how many steps that they've done in a shift. We almost compare steps at the end of a shift to see who, and have a joke about who's worked the hardest. Hello, Mick.
Sister Harriet's keeping a close eye on spacewalker Mick,
Okay,
as his heart trace was irregular.
you sure?
They're waiting for his results, but today's events have taken their toll.
What's the matter?
I just feel a bit down, a lot down.
Oh,
What's happened today? It's gonna get in with me training. We're so close now.
you've achieved so much though, haven't you, sweetheart?
Yeah.
For a patient in A&E, it's quite a daunting and scary time for them. It's really important that we get them seen and treated, but often it's just as important to just sit and talk to them. Sometimes that is therapy in itself. You know you've broke those records already. Push yourself a bit too much today, haven't you?
Yeah.
You've so much to be proud of, haven't you?
What do you about training?
Oh, bless you. I hope Mick achieves his record, because there's not many people around like Mick.
Tests later revealed Mick had a heart attack. After surgery to fit a stent, he was feeling much better and as eager as ever to get back into training. In the hub and nearing capacity, lead nurse Hannah is trying to free up beds.
So 4's going and 10's going, that's fine. So I've written here a late waiting room, can we make sure they go back in just because we ain't got ambulance capacity?
Pop that on your lap for now, yeah? I'll put it over you properly in a second.
Helping patients in paediatric casualty is student nurse Greg.
So what happened, mate?
I was playing football and I tripped and hit my head on wall.
Who did this bandage at school do it?
Yeah.
It's a good one, that. During college and things like that, I was a part-time swimming teacher, and I really enjoyed interacting with kids. And then my granddad has sadly passed away. I saw all the work that the nurses were doing in hospital, and I sort of put two and two together and thought, oh, you know what, I want to help people, but still work with children. Well, I've done that proper, mate. So what I'm going to do, I'm going to put a bit of a wet bandage on it to stop it from sticking. Then we'll put another bandage over the top. Is that all right? It actually looks nice and clean, man. It looks like it'll come together quite well. I don't think a lot of men are drawn to paediatric nursing. I don't know if it's because of the stigma around men in nursing, really. I'm not really sure, but I just love working with kids. I think I'm still a big kid at heart anyway. Perfect. Right, mate, if you want to take a seat out in the waiting area, we'll get a doctor to come and look at you, yeah?
I'll wheel you out.
Thanks for being really good.
Paramedics are on their way with another emergency patient. Brian has fallen hard onto concrete flagstones while gardening.
Let's get you on the trolley then.
He'll be consultant Dr. Sue Mason's first patient of the day.
Would you like to have a seat, my love?
As he's been having problems with his memory, his wife Iris has come along with him for support. As nurses are busy with the department at capacity, Dr. Mason is taking this handover herself.
Blood pressure 108/56. Yes, 15, but he does have memory problems from a previous cardiac arrest.
Brian's been in agony for a week, ever since he fell backwards in his garden while pulling up roses.
I got to the last one and I was tussling a bit, and then all of a sudden changed his mind and boof, I went back straight back.
Poor old you. Shall we just have a little look at the beast? There we are. Well, that's very impressive, isn't it? The first thing we need to do is x-ray it. There's quite a lot of blood here that's leaked into the skin. It's really warm, so there's a lot of inflammation going on as this is trying to heal it. it'll take weeks.
Did you hear that, Brian? Yeah.
So this is not going to go away quickly. There may not be a huge amount that we can do to speed things along. I'm concerned that because he's in so much pain, there may have been a fracture that he sustained when he originally fell that needed to be identified. If he goes unchecked, he will just deteriorate further, and that would lead to really, really hard stuff. As it becomes, as the body tries to reabsorb it, it becomes very liquid. And occasionally, what we can do is pop a needle in and draw that out. At the moment, if I popped a needle in there, nothing would happen. We just need to make sure there's not an underlying bony injury that could have happened at the same time, particularly around the pelvis, so I'd just like to check that if that's okay.
If his condition deteriorates, Brian could be facing surgery and a prolonged stay in hospital. The onset of winter is having an impact on Barnsley Casualty. During the pandemic, patients with respiratory problems are treated in a separate area with a dedicated nursing team, hot resus.
ED Hannah speaking.
But lead nurse Hannah has to find the staff to care for all the other emergencies.
We have got quite a busy hot resus at the minute, so I've got 2 nurses working in there with 2 poorly patients.
In Resus Bay 1, Carol's awaiting test results to see if a heart attack caused her collapse.
It's quite full.
The team have concern she's hypothermic, as her temperature is still dangerously low at 34 degrees. It should be 37.
Let's get this air hugger on you. Yeah. It's going to warm you up a bit and then you'll probably shake a bit less. Alright.
The extra blankets haven't worked, but the machine will help raise Carol's core temperature.
Stop checking her teeth, stop fluttering. What happens sometimes with air hugger, it warms everything up so your veins open up a little bit so you can drop your blood pressure a little.
With concern she may have already had a heart attack, a sudden drop in blood pressure could trigger a cardiac arrest.
Right, so I just need to recheck your temperature if that is okay, just while this is on. Coming up slowly. Tell me if you get any pain at all, won't you, Carol? Lovely.
Thank you very much. You're welcome. Thank you.
Sister Sonia wants to let Carol's daughter know how she's doing.
Hi, my name's Sonia. I'm assistant ED at Barnsley General, my love. I'm just looking after your mum. Just got her in our resus department at the moment. We just want to keep an eye on her heart, that's all. Obviously, any concerns, Sarah, just give me a ring, my love, alright? Thanks, bye.
Back with an update is Dr. Griffiths.
Hello. How are we doing?
Okay.
So, blood results are fine. No evidence of a heart attack on your blood tests. So that's very good news. Doesn't explain quite what's happened this afternoon. So I think we'll keep you in for observation and maybe some more tests to see if we can get to the bottom of it. All right. So we'll get you up to the ward as soon as.
Carol was kept in overnight and heart issues ruled out. She's back home and feeling better, but having further investigations.
Does anybody know if 6? Jenny, have you got a patient in cubicle 6? Right. So, Ian, are you free? Will you move lady in 3 into 6 so that I can take an ambulance straight into 3?
As one bay in resus is freed up, it's immediately filled with another emergency. Taking the handover are Nurse Jess and Dr. Nis Hathiari. Paramedics have blue lighted in a patient who's had a fall, then a seizure.
Not bad.
How long's the fall?
Yeah.
She has moments of confusion,
Okay.
uncoordination, unserenity.
Yep.
Unsure if it was a seizure that's caused the fall. We're preparing to take him in anyway, but as we're about to get him on our carry chair, he had a seizure.
Alan has epilepsy.
Alright, let's get him across. Hey up, Alan. How are we doing?
So I spoke to his sister over the phone, and she has said it seems like it's been deteriorating more over the last few weeks.
Alan? Hello? Alan, my name's Nick. I'm one of the doctors. You're in hospital at the moment. It sounds like you've bumped your head and you've had a seizure.
Dr. Hathiari has concerns that Alan may have a significant head injury or bleed on the brain.
Alan, we need to do some blood tests on you, and then we're going to get a scan of your head, okay?
Alan is being monitored closely by Nurse Jess.
You want me rice from me, Alan? Oh, brilliant, well done. And your other one, sweetheart. Recess is my absolute favourite place to work. It always has been. You know that you've got the sickest patients in the department with you at that point, and it's your responsibility to provide them with the best care that you possibly can.
Sahathiari wants to get images as soon as possible to determine if there's any further head injuries.
Stay nice and still.
A scan will reveal if Alan's fall has caused any brain damage. As they wait for Alan's results, another head injury patient needs treatment in Children's Casualty. Jaden is having his wound cleaned by student nurse Greg.
Ow. I'm sorry, mate, I'm sorry. We have to clean it, yeah? Right, he's going to do this quickly, yeah? Just go and bear it. I know, mate, I'm sorry. I need to dry it, otherwise it's not going to stick properly, yeah?
Hello, Jaden. I said you've got a troublesome cut. Can I take your feet? Sorry, this is sore. So, I think we could glue it with a bit of a team effort and a little bit of something to protect over your eye. I think we'll give it a go and see how we get on. Is that alright? So, just lie this way. I can see it a bit more clearly now.
What school lesson should you have had today?
We should have had maths,
Oh.
which I hate.
So in a way, you're glad you're here.
Yeah. But another way I'm not.
Yeah, no.
Fair enough.
For student nurse Greg, every day is a school day.
I think doctors and some nurses are even more experienced, know how to get a wound just perfect. So you think the more times you do it and the more practice you have, the better and better you get at it.
It's the kind of thing that footballers get done on the side of the pitch. Get a bit of a cut, have a bit of a clean, bit of glue on it, back on you go. Sit up for a minute. You will, even though that edges come together, so you might always have a little bit where the hair in your eyebrows doesn't grow on that little patch. Don't be tempted to pick it, because that glue, it forms like a bit of a, it's almost like a man-made scab. Thank you. You're so welcome, mate. Nice to meet you, Jaden.
Come on, let's go. Alright. I've seen some children that are a lot braver than adults, and some like adults that would make a real song and dance about it. Yeah, I think some children are really, really tough.
In the hub, lead nurse Hannah is doing all she can to keep the flow of patients moving through Casualty.
There is some beds available in medicine, but there's some delays on AMU currently, so hopefully we'll start to get them patients up soon.
With a high proportion of seriously sick people, there are fewer nurses to help new admissions.
We're doing a short as well, so that's going to add to our problems.
If nurses are tied up with very poorly patients, that's when we call on our medical colleagues to help us, and they often assist with assessing patients and moving patients within the department.
I'm just waiting for Tarek to do his DTA, and then he can just go straight up.
With the team working flat out, Dr. Mason helps with the shortfall.
Right, let's take a drop of blood off you. Have you got a good arm? Marvellous. A bit skinny. Just drop your arm down for me, that's marvellous. Oh, that's the phone again. The little scratch coming up. With older people, there are several things that can happen quite quickly that can cause patients to feel really fatigued, and it's important to identify those. He has lost quite a lot of blood into that bruise, so that shows me that there's quite a lot of blood held in that area of the body. And I want to check that his blood count hasn't dropped. How long have you known each other?
81 years.
Oh my goodness.
We were at school together 5 years ago after we'd had a trial with someone else. We were both married before. It was music that got us together.
Well, I think it's really interesting just to ask people a bit about their background. So there's often a method in doing that. One of the things is learning a little bit about their support structures. So learning a bit about who's at home, who they're in contact with, what family they have, and how close they are.
Brian sings.
Yes, I sing. Yeah.
Oh, I got a choir.
I do sing in a choir, but I used to sing a lot more on my own, but I don't do that anymore, I'm too old.
My choir is noticeably over 70.
So's mine. Yeah. And then you got back together just by chance, or?
Brian was in a choir in
the village where he lived, and they asked him to sing solo. So he rang me and said, could he come over and rehearse with me? And eventually we got together.
I'm just about got used to it now.
I've got used to it now.
I can't believe you said that.
Dr. Mason has arranged an X-ray. If there are fractures, Brian could be facing an operation and months of rehab. As they wait for Brian's results, married couple Bev and Brian arrive after falling ill at the holiday cottage they've rented.
There's 2 chairs in there if you want to take a seat.
Nurse Jasmine is triaging.
Hello, how are you feeling?
Big Rocky.
Have you got any chest pains or anything?
No, I was just a little bit short of breath.
Feel short of breath as well? Or?
Just felt really dizzy. Just like I've got a hangover, really bad hangover.
You definitely weren't drinking then?
I had 1 glass of wine last night.
Yeah, not enough for a hangover, is it? What is it that happened?
We're staying in a holiday cottage,
Okay.
and it's got a log burner.
Okay.
And there was some little fumes coming from it.
Yeah.
The carbon monoxide detector went off a couple of times. And when we got up this morning, the fumes were still significant downstairs.
Yeah.
So we phoned up 111 and they advised us to come here within the hour.
Okay, yeah.
Yeah, we're only 10 minutes away from him, aren't we?
Yeah, well, fingers crossed.
And we've got
tests
Georgia,
are
our
alright.
Cocker Spaniel
Yeah.
with us as well, so we've had
So
to
my
leave
brother's
him
took my
with
dog.
brothers.
Yeah.
Oh, you should have brought her with you.
So worried about him.
Yeah.
Also, I didn't really sleep much last night.
No, of course.
So I kept checking to make sure he was alright.
Yeah, I think you get more worried about your dog, don't you, than your brother sometimes.
Yeah.
Yeah, so we'll do a blood test on you both.
Yeah.
Tells us the results straight. Right, I'll be back in a few minutes, okay?
Lovely, thank you. Available.
My name's Adam. It's alright.
Carbon monoxide poisoning causes around 60 deaths every year in England and Wales. Symptoms can include chest pains, seizures and brain damage.
We'll get after some back out of the office.
Yeah, lad. Thank you.
The blood test will measure whether any lethal gas has been inhaled. If they have carbon monoxide poisoning, there could be long-term effects. At Barnsley Hospital's Casualty department, as winter kicks in, extra pressure has been put on the team with an increase in patients. But now, there's been a breakthrough for lead nurse Hannah.
We've just had some beds that have become available, so it's trying to move patients out now. Thank you. Bye.
In the imaging room is Alan. He was rushed in for a head scan after a fall at home and a subsequent seizure. Dr. Hathiari is concerned he could have sustained brain injuries.
Alan, how are you feeling?
Not fine.
Okay, that's good. And this, I'm one of the doctors.
Yeah.
It sounds like you had a seizure earlier. And because we weren't sure whether it was caused by the bump on your head, we've just done a scan of your head, so we'll just wait to see what the results of that look like.
Yeah.
Okay.
Alan is being monitored closely by Nurse Jess.
How are we doing, Alan? At 16, I started as an old school apprentice on our stroke ward. How are we feeling? I got connections in A&E, went and had a bit of a tour, completely fell in love with the place, and that was 9 years ago. A bit ropey, eh? And now I am a staff nurse.
Should we just lift this arm up for a little bit? Alan, so I'm just going to put some oxygen on you, so it's just up your nose.
He's known to have seizures anyway. There's a good chance that he might have just fallen and also had a seizure as 2 separate events.
Alan, can you take some big deep breaths through your nose for me?
That's why he came to us, and that's why we did a scan of his head. And the scan has been reported and it looks fine.
Alan was kept in overnight for observation. He now has extra carers to support him at home and is doing well. Leaving X-ray is green-fingered but badly bruised Brian, who's been involved in a war with his roses. Looking at his results are Dr. Mason and Junior Dr. Tom Lee.
This is the affected area, so he's having pain in the hip and the pelvis. Thought so. This guy's got a massive haematoma. And he's dropped his hemoglobin, which would explain why he's feeling tired. And it's like he's got no energy. There we go. I'm not as daft as I look. How are we doing? So your x-ray's fine, nothing broken, which is good. Now, I've got your blood test results back, and the blood tests do show that your blood count has dropped quite significantly, probably as a result of where it's all gone into there. So you're now quite anemic, and I think that's probably why you're not feeling too great. So what I'm suggesting is that we put you on some iron tablets to lift that blood count back up again. You will start to notice a difference in a couple of weeks' time. Your blood count will be going up and you'll start to feel a bit better, which is really good. All right. So, home it is then. Okay. Thank you.
Very, very good, sir. It's the best I've seen. Hello. The car's quite away with me, so stay in the chair until I come.
After a course of iron tablets and a few weeks' rest, Brian felt strong enough to tackle his hydrangeas.
Bye-bye.
Under the strict supervision of Iris, of course.
The long hair is quite big, isn't it?
And it's a big day for student nurses Greg and Molly, who are only a matter of weeks away from completing their course.
Are you going to go and get your uniform?
Yeah, it's just that one up there, isn't it?
Yeah.
Right back, yeah, I am.
Have fun!
Will do.
Today, Greg is getting measured up for his uniform.
Nerve-wracking to think that I'll be in the real world of nursing soon, but yeah, it's good. It's exciting. I used to end up in Casualty as a child, like once a year, every year. Broken arms, asthma attacks. Only recently it's started to. I've not had my yearly trip to A&E.
Have you got any paperwork?
I have indeed.
Right, so you went into staff list. Can you sign?
Yeah, of course.
Right, thank you so much.
Brilliant, thank you very much. Thank you for your help. Thank you.
Okay, thank you. Bye.
Oh, you've got these ones.
Uniform, yeah.
Oh, I thought you had scrubs. Aww.
That get on and drive everybody loopy. But they still love us really because we can be quite helpful when we want to be. When we want to be.
Aww, look at you. Look at you.
It's comfy.
Proper nurse now.
Yeah.
Aww.
I just need a yellow badge now.
Yeah, I know.
Greg is like one of those stuffed teddy bears that look like they're going to be like really hard or durable, and actually they're just soft and squidgy.
Fits better.
It does, and they look nice. You no longer look like a beautician.
The weird thing is actually saying hi to one of the staff nurses.
Yeah, I'm not ready for that.
And to stop saying, I'm a student.
As student nurse Greg comes to terms with his new role, in cubicle 9, Bev and Brian are waiting to hear what damage may have been caused by exposure to any lethal gases.
Hi, Brian and Bethany.
Their blood gases have been assessed by student Dr. Kayama Mardi.
Blood results came back. As long as your carbon monoxide levels are low, if it was above 5, then we would have to think about admitting you to hospital. But thankfully that's not the case. Yours, Brian, was 3.3, and Beverly, yours was 2.9, so...
Yeah, that's great.
Is that right? Yeah, do you have any other questions? Anything that's worrying you?
No, I think you've covered it really well. Yeah.
From our side, we're happy for you guys to go home. Thank you.
Thank you.
The tests confirm the carbon monoxide levels in their blood are low enough to not need treatment.
Relieved.
Relieved, yes. It's quite scary.
Did get a bit worried, didn't we?
Yeah.
It is a silent killer at the end of the day, and you have to take it seriously to be wary of it in the future.
The day shift is nearly done. Last job for lead nurse Hannah is handing over to the next shift.
And our beds have just started to come up at last hour a bit quicker. We haven't really had much movement. And I think that's it. Right, I'm going.
Because the NHS was under so much pressure, they needed more workforce really. Even if it's or making routes with people, triaging people. I think it made a really, really big difference.
Even though we do everything supervised, so we can get tea, coffees, we can help the parents out, we sort of help take some of that pressure off nurses.
In a month or so time, I will be a qualified nurse, and I will be in my blue uniform, not a student anymore, and it's quite daunting, actually.
You really have to become a nurse that when you take your scrubs off, you go home and then become a mum and a wife and a daughter, because if not, you'd never recuperate ready to come back again.
Next song.
And painful.
Yeah.
And you've had quite a bit of a concussion.
What's your name? Do you know?
I feel like I'm just waiting. I'm not getting anywhere fast.
Like that.
There's more next Monday at 9, and from Barnsley to a Seattle surgical wing where intern Meredith Grey is about to begin her career. Grey's Anatomy, Episode 1 on 5-star just a mo. Here on Channel 5, from police process to phone hacking, the investigation into the abduction of Millie Dowler has its own questions to answer in just a moment.